I'd like to give a brief update on the two pillars of Australia's fight against coronavirus: the containment and the capacity. In containment, we are always seeking to reduce the number of cases, and in capacity, to increase the ability of our health network to respond to coronavirus. On containment, our borders, our testing, our tracing have been fundamental, but in particular, I want to focus on what we've done as a country over the last weekend and the weeks before with regards to self-isolation. Australians have responded magnificently. I said before this weekend that Easter could be the most important weekend in our fight against the coronavirus. Australians have done what we had hoped and more. They have stayed at home, they have self-isolated, they have responded with the best sense of Australia imaginable. The hard data is that our transport movements have been below 13% over the Thursday, Friday and Saturday of Easter, with Easter Sunday data still to come, below 13% of the average movements for this time in an ordinary year. That means that Australians are making a difference. They are saving lives and protecting lives with their own actions, staying at home, maintaining the distance, responding to the requests. I couldn't be more impressed, more honoured and more heartened by the work of Australians over the Easter weekend and in the weeks before. This has a real consequence in the best sense. We are now seeing consolidation of the flattening of the curve. The latest data shows that we have had consistent growth in new cases of below 2% a day. What that means is that we are now beginning to see a consolidated flattening of the curve. That doesn't mean we're out of our challenge. There is still growth, and there could at any time be outbreaks and spikes. But this is a cause for real hope and real aspiration. We said at the start that we would get through this. We are getting through this, and now I know and I believe absolutely we will get through this. So I want to say thank you to all Australians for their action. In particular, I would note that there are now 6,335 cases in the advice given to me by the National Incident Centre shortly before joining you. Sadly, 61 Australians have lost their lives. At the same time, 3,338 Australians have now officially recovered from coronavirus. Well more than half of those who have contracted the condition have now recovered. In terms of our hospitals and our ICUs, 238 patients as at 6:30 this morning were in hospital. 81 are in intensive care and 35 on ventilators. These numbers have reduced and now stabilised, and that's a very important sign for the future. All of this is an indication that we are making real progress, not just here in Australia, but on a global scale. Our capacity is also being increased. In primary care, we have now had over 3.4 million telehealth consultations. Our aged care services are continuing to provide high-quality infection control and caring for those who are most vulnerable to COVID-19. And in our hospitals, today's announcements are about building on the partnership between public and private, building on the expansion of ventilator capacity, which is now more than doubled and is on a pathway to more than triple. And so these researcher announcements are about using CT to help with early diagnosis, to save lives and to protect the lives of those who are most at risk of intensive care and ventilation needs, and about using the highest quality data to help with the best treatment and the earliest diagnosis for those in aged care and in intensive care. So they're very important steps. Finally, I want to address questions that have been raised. I think it is very important to say that now is the time to stay the course, to continue with the self-isolation and social distancing. These are producing real reductions in the rate of growth, real reductions in the number of new cases, and real increases in the number of cleared cases. So I want to thank Australians